My name is Dr. Matthew Carpenter. I'd like to take just a couple minutes of your time to discuss one of the more important conversations that we have in our practice with our patients. It's one of the most emotionally charged conversations that we have in our practice. And that is on the topic of how to replace missing tooth structure in the mouth. You know, the reality is a lot of patients are actually seeking our care because the material that was placed in their tooth or in their jaw 20 years ago generated and contributed to health problems. So we take a lot of time and thought in what we choose to put back in someone's body. Ultimately, what we choose depends on the patient. They are the complete boss with respect to what we are going to do. And I understand that when people lose teeth, there are strong emotional feelings associated with that. Feelings of youth, feelings of beauty, feelings of being socially at a good status. These are all things that culturally we've adopted as we look at people's smiles. So I'm not insensitive, and we don't just take teeth out without worrying about how people feel about it. But the reality is, what we're trying to do differently in our office is stand for one thing, and that is for health. So although as a patient in our office, you will receive information about every possible option for replacing a missing tooth or replacing a portion of a tooth that we removed, I always try to keep my targets centered on health. And then the patient can make the choice whether they want to pursue the option that is going to deliver the best possible health to them, or if some of their other values are higher for them than health. In general, the patients that we see are all different. I mean, you think about, you walk around on the street, you don't see two people that look alike. I mean, we all have people that we see that remind us of other people, but nobody looks exactly alike. I mean, everybody's unique in their own little way. That's just a small example of how it is with health, how it is with materials that react certain ways. Everybody is different. So the consultation we have in my office is not like, you know, people have typically had in a dental office where we're like, well, you can do the bridge or the implant or you can do this, you know. There's a lot more to it than that. There's a lot more to consider than that. That's really a mechanical model, and it's not really appropriate for a complicated individual. So one of the things that I like with my materials, because my goals are for my patient's overall improvement of health, is I like to know that the materials that we're using don't leave any type of memory or footprint that they were in the body. That's one of the things about the types of materials that we are using mainly in our culture right now because of the advantages that we have. They're metal based. They're based in aluminum. They're based in nickel. They're based in cadmium and chromium and mercury and these things. These are not metals that were chosen because we wanted to hurt people. I believe that they were materials that were chosen because of their working properties. They are strong. We chew with our teeth. We need something strong. They hold up well in a wet environment. There are some good physical properties of metals that in the past people thought, well, that's a good thing. You know, we can use that and that'll last a long time and that makes patients happy. The problem is what is happening to their hormonal system or their immune system in the process of housing a poisonous metal. Most of the most health-centered choices for how to replace missing tooth structure or missing teeth are going to be metal-free options. And in my practice, we have an exhaustive list and menu of different metal-free options. There's not just one thing. One of the best adjuncts that I can think of to trying to choose a safe material or a safe replacement for a patient is to have what's called a compatibility test. And we offer a biocompatibility test in our office. And basically what this test does, it's a serum compatibility test. And what that means is that we're going to take a little blood, we're going to draw a little blood, we're going to spin out the serum, and we don't do this in our office, this is done at a lab in Colorado. And what they do is they take the immune cells or the serum out of the blood, and then they expose it to the different chemical components of all the different things that we use in dentistry. Some of those things will force your immune cells to react real violently. We consider those to be very highly reactive materials for that individual. Some of them will give a little bit of a response. We consider those moderately. Some of them give a little response. Depending on the health or the illness of the patient we're serving, it creates an intensity around how, lowly reactive we want the materials that we put back in there to be. What we believe in and what we're trying to do is, we're not magical healers. We're safely removing metals and poisons that have been shown in research to challenge people's general health. So we don't heal people. All we do is try to get the healing barriers out of the way so that the body will heal itself. Praise God, that's what God designed into our bodies, there's a life force. We always want to heal. All we're trying to do is remove the barriers that are preventing that body from healing. And I think one of the most thoughtful things that we do that way is try to match up materials for each individual that show that they're not reactive or stressful for that patient's body.